Okay, 7:14 now. Time to ask the doctor this morning. This is a chance to learn more about exactly what frontline workers are dealing with when it comes to COVID-19 in our area. Of course, it's an ever-evolving situation, and we're happy to have Dr. Ralph Riviello back with us here this morning, Chair of Emergency Medicine at University Hospital, among other things. But we like leaning on your expertise here because, as we mentioned, this seems to be evolving. It seems to be trending, Doctor, in the right direction in terms of local numbers, but what does that tell you about the overall success here in San Antonio?
So I think it's a great testament to what we've done here in San Antonio, that we've had a decrease in our COVID cases steadily over the last several weeks, and our positivity rate overall has now decreased.
So all the numbers, yes, seem to be trending in the right direction here, but we are coming up on a Labor Day holiday weekend. We are coming up on a lot of big districts letting kids back in the classroom next Tuesday. Any concerns about the timing of that and what we've seen in the past with Memorial Day weekend, 4th of July weekend, people getting together and potentially spreading it more?
Sure. So anytime there's a potential for large crowds gathering, I think we have to be concerned that we may see an uptick in cases. However, I think we've gotten used to all of the precautions we need to take, and masking and social distancing. And I think people were a little bit scared of the increase that they saw. So I think people are going to do their best to keep safe and try not to do the things that may have caused the increase back Memorial Day and 4th of July weekend.
Another milestone we saw, over the weekend was the return of high school football in some of the smaller, more rural communities, games being played, live games with live crowds in the stands. Are you comfortable with that? And do you feel like we can get to a place here where you could ultimately, have everybody playing ball once again?
So that's a great question. I think we still need to be cautious, especially with contact sports. There's a risk of aerosolization of respiratory secretions, nasal secretions during that contact. I also think that the close proximity of fans in the stands can also lead to that. Hopefully they're masked and practicing some social distancing, using good hand hygiene and that, but I think it's something that we really need to keep a close eye on.
Do you have concerns? We mentioned the numbers are trending in the right direction, but fall is approaching. It's supposedly we'll be getting cooler here soon. We've been in this for 5-6 months now. Do you get the sense that people may start to let their guard down a little bit, and it feels nice outside, they're going to want to get out and maybe be a little bit more careless?
Once again, people will be people, so that's always a possibility. I think we've gotten so used to doing the things we need to do that it's become a habit for us. So hopefully they won't let their guard down or take their masks off just because it's a little bit cooler and they're out and doing more.
Mm-hmm. What do you think about flu season coming as well, and what, if any, impact do you think that might have in terms of just the numbers that we've seen so far, people getting their vaccines or being worried about going to a doctor's office or a pharmacy to get vaccinated?
Sure. So I would stress that people should get their flu shot this year, like they should every year before COVID hit. It's been proven to help decrease the spread of flu and protect people at risk who have serious complications from the flu. I think the challenge for us in healthcare is going to be trying to determine who has the flu versus who has COVID, or who has just a regular respiratory virus that we see this time of the year. And I think people should be comfortable to go to their primary care physician's office or a pharmacy to get the flu shot. Mm-hmm. I know a lot of the stores and pharmacies have masking in place. There's hand sanitizer, PPE for the folks giving the shots. Same thing with the doctor's offices and clinics. So I would feel very comfortable to go get my flu shot.
And lastly, getting back to the schools here, I'm not sure how much you paid attention to the positivity, the number of cases in some of the school districts that already have kids back in the classroom. Are you comfortable with how some of the districts are handling how they tell people and some of the practices they have in place to prevent the spreading?
So I think the key to school transmission is the plan that the schools have in place to prevent the spread. So screening of employees, screening of students, social distancing practices, masking, availability of hand sanitizer, classroom setup. I think all of those will help to decrease and possibly prevent the spread, but it needs to be continually monitored. Faculty and staff need to be aware of these, making sure the students are doing what they're supposed to do, making sure the other faculty and staff are doing what they're supposed to do. But I think at this point, as we're heading lower and lower in the positivity rate, it most likely will be a safe experience for students.
Okay, well, we'll find out for sure one way or another in the coming days, and hopefully the numbers will continue to trend in a positive direction. So, Dr. Riviello, thank you as always for your time, sir. We appreciate it.
Oh, thank you. Have a great day.
Same to you. Thank you.